Today we'd like to talk about your new view in Cerner. You're going to find this new view in your top band called Nurse View. And here is what it looks like. Many people call this an MPage or a workflow MPage, so you might hear it called that. You also might hear it called your Handoff MPage. This is the new view of the patient's chart, and it's the same view that our providers have now. It's the place to go to review information about your patient, to obtain new results, or to read new clinical documents. Our goal is to show you 80% of what you're looking for and to save you time by not having to click in numerous places throughout the chart. This handoff view also provides a single place for our IU Health nurses throughout the hospital to perform a handoff, whether for breaks, at shift change, transferring from unit to unit, or from hospital to hospital. All of our inpatient nurses and our ED nurses and peri-op will have the same view of the patient. Let's talk about how this tool works. First off, if you need more room in your view, you can pin back the old table of contents or pin it open. This is your new table of contents. The great thing here is that you can move these items around to put them in the order that makes sense to you for chart review or for a handoff communication. You can also choose the components that you want to see. If you take care of pediatric patients, you may want to see immunizations, but for adult patients, you may only need that during flu season. Just click or click off. You can also refresh the entire page by hitting our normal refresh button, or you can refresh a single component by hitting the refresh button here. If you make changes to this, make sure that you hit Task Exit when you close the patient's chart in order to save your changes. Let's talk a little bit about how the components function. Each one of these is called a component, and it makes up your whole MPage. Most components will link out to an old part of Cerner or to your traditional view. So when we hit Labs, it linked out to Results Review. Use the arrow or the home button to go back to where you were. Micro will link out to your Micro tab, etc., etc. Vital Signs is a normal view of vital signs. Over here is another way to see those same results. This patient only has one set of vital signs, but you would see up to about 15 sets going across. And most of these result type of components have filters on the right-hand side. So if you're not seeing what you expect to see, click another filter. Documents is our normal clinical documents. And then back to our component view. And you can change the type of documents that you're looking for. Clinical notes all, interdisciplinary, physician notes, and procedure notes. Again, if you're not seeing what you expect to see, check your filters. The medication component links out to the MAR, the traditional view of Cerner, and most components will work that way. I'd like to highlight a couple components for you as you prepare for a handoff conversation. Communication information is going to pull in details that you need in order to successfully communicate with your patients and families. Key notifications will pull in some items that you've told us are very important when you're trying to care for your patient. Mobility, assistive devices, sensory deficits or sensory devices, telepack number, and other key items like that. Risk indicators will show you the last documented Braden score or Braden Q score, Johns Hopkins, Morse, or Humpty Dumpty. Order details is going to pull together those orders that you've told us are very important when you're prioritizing the care of your patient. So you'll see diet orders, their mobility orders, oxygenation orders, telemetry, precaution orders, restraint orders, and some other key orders that will help you immediately know how to safely care for your patient. Patient education is available in this new view as well. It is very much like the traditional patient education from your toolbar. And once you've chosen the education, printed it, given it to the patient, if you click Full Assessment, that's going to take you right out to the IOI flow where you can document the education you've just given. Discharge planning is another great component. This is going to show you information that was charted during the nursing admission history documentation so that you can help plan for the patient's safe discharge to the next level of care. It's also going to show you anything that was charted in terms of valuables and belongings for the patient so that you'll be able to safely transport those from unit to unit or as you prepare the patient for discharge. Scales and assessment is a very odd name for the component, but what this is going to show for you are significant event notes or narrative nursing notes that have happened during this patient's stay. If you click out, that's going to take you right to that tab in Results Review. And finally, I'd like to show you handoff documentation. If you and your team document Safe Handoff or Nurse Handoff, that last documentation will always show here for you. Your handoff view replaces the old nursing communication pages, but there are a few components that don't have a replacement yet on our new view. Nursing communication is now just called Assessment, and here's what you'll find there. Caps, tubing and dressings, lines, tubes, drains and wounds, oxygen and ventilation, and our quality measures summary. Cerner is continuously developing new components, so you will see updates to your new view about twice a year. As they develop a new component for oxygen and ventilation, it will move to the new handoff view and will retire it from the assessment tab. Workflow MPages, like the handoff view, are the newest tool for working within a patient's chart. In the coming months, IU Health nurses will implement task-focused workflows for admission and discharge. Thank you for watching this short video, and remember to task, exit if you've made any changes to your view.